You could help support the One Thing podcast by visiting our affiliate sponsors. I've teamed up with Healthgevity, which is a company that I learned of over the last several years. I really enjoy what Healthgevity is doing. They've revolutionized the wellness industry by providing the finest quality and most effective nutritional products for ultimate health span. They work in tandem with doctors, patients, and researchers to design real advanced formulas that, frankly, I have not seen done on this level before. Please visit them and see what they have to offer. If you find various products that you're interested and you're looking for a discount, you can enter in the code one thing, all one word, one thing, for a 10% discount. This will not only provide you access to excellent health supplementation products, but also will help support the podcast. Thank you so much, and I appreciate your support. Today on the One Thing podcast, I'm speaking with Dr. Zara Nasir. She's an osteopathic physician and founder of Zara Care, which is a concierge telemedicine practice that brings holistic addiction recovery and primary care under one virtual roof. What's unique about Dr. Nasir isn't just her credentials, it's her story-driven approach to healing and addiction. She's developed visual tools that demystify opioid dependence and recovery, breaking through resistance and rehumanizing patients who have often felt invisible in the process of recovery. In this episode, we explore how she's reimagining care from the ground up using visual storytelling, Eastern philosophy, and a deeply integrative lens to meet patients where they're at. We unpack the science of medication-assisted treatment, why addiction is not a character flaw, and how balancing 6 dimensions of health can shift someone from survival into purpose. If you've ever wondered what it's like to truly destigmatize addiction, or you're a clinician looking to build trust and transformation in hard-to-reach populations, then this is a conversation for you. So without further ado, welcome to the next episode of the One Thing podcast. Dr. Nasir, welcome to the One Thing podcast. It's a delight to be here with you today.
Dr. Indy, thank you so much for having me. I am so looking forward to our interview today.
Thank you. I am as well. There's a lot to catch up on. It was great meeting you offline, and I just would really love to start off our conversation, hearing about the launch of Zara Care, and if you could tell us a little bit about, what you're doing with Zara.
Yeah, thank you so much for asking me about Zara Care. This is going to be my concierge telemedicine practice across California. And the way that I'm going to be using this is my goal is to bring the care of addiction medicine with primary care in a holistic way that provides support based on empathy, understanding, trust to help individuals get the care that they need to go from where they are in their addiction journey to where they want to be as a successful, sober individual in their life.
And what drew you to focusing and specializing in addiction medicine?
I always go back to all the stigma that I had against addiction when I was, be it a regular person, medical student, resident. I definitely took part in, the stigma that people entertain, the hate fest, as I like to call it, against individuals who are suffering from addiction. In third year of medical school, I saw a baby suffering from neonatal abstinence syndrome. That is a baby who was exposed to opioids in the uterus when the mom was pregnant, they were using. And so this was a very heartbreaking thing to see, just an irritable baby, unconsolable. And the nurses in the nursery, they were, being like, oh, what a bad mom. How could she do it? Not take care of herself. And this baby's pain is her fault. And at that time, I was also holding that baby, feeling bad, and then also sharing with their angry feelings towards the mom and the dismissal of it. And then fast forward to residency where, so sorry, I forgot to mention in medical school, I was in the Appalachians where, the opioid epidemic had hit really hard. And then fast forward to residency, I move up a little bit into New York, in the upper state New York. And what it ended up happening was it was on the drug belt that went from Mexico to Canada.
Hmm.
So there was a route going through there. And we also had a pill mill problem with prescription opioid at that time. And so, saw the devastating effects of opioid addiction in families. There was this patient who was brought in by his father. So this is an adult man brought in by his elderly father who should be retiring, worrying about grandchildren and stuff. Instead, he's having to like you can see the stress on his face and his hair is extra gray of seeing his son just going astray. And so I went to my attending and I was saying like, how could they do this? Like, what's wrong with these people being like, the people that are being addicted. At that moment, what my attending told me basically changed my perception. And I think that was probably what drew me to addiction. He told me, Sarah, you do understand that addiction is a disease and it changes your brain. It's not just a moral thing, right? And so that just struck me. And I felt so guilty for all those moments when I partook, even if I wasn't like externally taking part in it, I was internally, agreeing with it. And so all those like inner realizations just struck me because at the end of the day, they're like suffering with life in such a more harder way than everybody else is suffering. And something about it, that what my professor said made me take a closer look at it. And so when I finished residency and I started working in DC, there was a lot of funding available at that time to train family medicine doctors to become prescribers of Suboxone to address the opioid addiction. And so as I learned more about it, I don't know, I fell in love with it. I fell in love with being able to see a person transform radically, right? I used to take care of high blood pressure, diabetes, and all these chronic diseases, and people just didn't care. It was like pulling tooth and nail to have somebody change their lifestyle. But with addiction, also, the rewarding aspect for me was that you can see a difference within a year of somebody who is malnourished, poor hygiene, the social situations are just all over the place, and then come a year later those who are successful of going through the process, the resilience that they put in, the amount of healing they did is just really so gratifying. So I got into addiction medicine. I guess some of it was a way of like making up for the way I felt. And then I'm staying in it because of the satisfaction it brings with being able to see the success stories.
Mm, very nice.
Thank you.
Brought a smile to my face because it reminded me of a patient when I was going through my training that had a similar transformation. And I remember going out to greet him in the waiting room and like looking around the room for this particular patient because I thought he hadn't showed up. But, he was like, "Hey, Dr. Rindy, I'm right here." And I did a double take and you could see how much healing had taken place. And so I know what you mean where there's sort of like a transformation and healing that unfolds in front of your eyes. I mean, that takes a lot of work, though, as I'm sure we'll get into.
Yeah.
With the name Zenara, what does the name represent?
So Zenara is mainly stemming from the word Zen, which is, the peace, the tranquility that comes from balance in life. Definitely a fan of the Japanese language and a lot of the Eastern Asian philosophies when it comes to the holistic way of approaching things. So I wanted to create something because when I take care of my patients, all of my descriptions is trying to get the body back to balance. Because, I'm an osteopathic physician. So some of the first things that we were taught in medical school is that The body has the ability to heal itself.
Mhm.
So get out of the way, stupid, right? That was like a joke that our professors added. And then also that the body is a unit of mind, body, and spirit. And so the founder, Dr. Andrew Taylor Steele, when he was developing this new approach to taking care of the human health, where the patient in front of you is not just a manifestation of disease, but rather disease is a result of dysfunction in their regular bodily functions that should be there. So, being present with the patient, so that patient centered care started around the philosophy when he was dealing with osteopathic medicine. And he developed this right after the Civil War, where he saw that, the soldiers, the wounded soldiers, when they were brought back to the treatment camps, the if they got a shot on the leg, it was a little infected. The treatment for it was chopping off the leg, right? No consideration about how that made them feel down the line to not be able to ambulate properly. Like, sometimes some religious sects like Jehovah's Witness, they have a lot of health observations that they do for spiritual reasons, not taking those into considerations neither. So the osteopathic medicine kind of stemmed as a result of his experience in life. Also, when he lost his son to pneumonia, like his son was like 7 years old or younger,
Yeah.
and just the way that, you know, the process that he and his family had to go through in the hands of contemporary medicine of that time, no other alternatives, basically. So, all that basically gave rise to osteopathic medicine. And so that comes into my philosophy in Zara Care that we need to approach addiction holistically. You can't just throw medicines at it, although it's a very important part of the healing process. But also, I like to say you need to take care of 6 dimensions of you. And so I have a coaching practice on the side that's called Transcendent. And I define transcendent as an inspired soul who transcends their limits, connects with their limitless soul, harnesses the power of their purpose, and lives a fulfilling and thrilling life of design. And the way to do that is also to optimize the 6 dimensions of themselves: the physical dimension, the mental, emotional dimension, the spiritual dimension, social dimension, financial dimension, and aspirational dimension. So I kind of bring that into what I do with when I'm taking care of my patients in a medical setting as well, where we talk about what else is important to them, because it's important to find the sun in your horizon, in my opinion, because we all go through ups and downs of life. Some have a more severe situation than others in different dimensions. But I believe all of these things, the ups and downs, the challenges, the obstacles, are meant to help us grow and become the transcendent version of ourselves. And so when I approach addiction that way, I'm talking with my patients not only about how much fentanyl they're using right now, but I'm also talking about how are the other things in their life doing, like their PTSD or their chronic pain. Just today, I was speaking with a Spanish speaking patient, and she has scoliosis. Scoliosis means that you will have back pain depending on the severity of it. And it sounds like she has a pretty severe version. However, doctors are not willing to give her the pain medicine that she needs because she ended up taking more than what was recommended, which is also, the art of trust comes in, because you don't want to give a prescription to somebody and then have them go take it in a way that harms them,
Mhm.
because I don't want that on my conscience neither. However, not taking all of these other dimensions of a patient or a person into consideration when you're devising the treatment plan, I think it doesn't serve the patient. So in Zara Care, that's kind of what I want to do, to be able to take more time to sit with the patient who needs it and address their health journey through all the dimensions that are important to them.
Okay. And you're calling your approach an integrative care approach that combines addiction recovery with primary care. How does that look to the patient?
So, what should it look like to the patient is, somebody who's struggling with opioid addiction or alcohol addiction, benzo addiction, methamphetamine. So, one of the substance addictions, I don't take care of gambling or sexual addiction at this time, not the behavioral addictions necessarily, but more for the substance use disorder. Oftentimes, I find patients like them don't get, because of this existing stigma, a lot of their care doesn't get addressed in a way that's very cohesive, right? So if they have diabetes, if they have high blood pressure, hepatitis C, HIV, a lot of these conditions are very common in a person suffering with substance use disorder. And so what this would look like, because the other thing that happens is that the patients will not go get these other conditions to get treated.
Right.
All they care about is not hurting, because pain is a very powerful way of us getting quickly into action.
Hmm.
And so they only focus on the immediate experiences, whether it be the euphoria or the noxious, painful stimulus. They just want it to stop. So all the other damages that are happening on the side with the silent chronic diseases, their asthma, etc., they're not as worried about that. So in this situation, I think it's very powerful to be a primary care doctor, which I have done in the office settings when I was not a medical director at a methadone clinic only. It's very powerful to have the person come to get their substance use disorder treated. And at the same process, same time, we're addressing these other conditions like their thyroid disease. Also, sometimes people just ignore it completely. Also, a little bit of the mental health conditions like some depression, some anxiety, some ADHD. The higher acuity mental health needs, those I will refer out, like severe schizophrenia, severe bipolar disorder. But otherwise, it's just that another element that goes into the overall primary care.
Sure, sure. That's brilliant. I mean, I think what happens a lot of times when someone has a major diagnosis or a major health concern, the entire care team just becomes very myopic and everything runs through one lens. And like you said, things fall to the wayside. We see this happen when someone gets a cancer diagnosis. We see
Mhm.
this happen when someone gets an inflammatory bowel disease diagnosis, big, major healthcare concerns. And then nobody talks to them about other things. They're like you said, a holistic being.
Yeah.
So that's a brilliant approach, and they're really fortunate that you're seeing that as a need. So with the modalities and philosophies that inform your approach, what are some of the pillars that you've used to formulate as like principal foundations of your approach?
So I think some of the principal foundations of my approach is communication is key. I think communication is very important because if you're speaking a different language to a person than they can understand and interpret, people are not going to follow through.
Mhm.
And by different language, I don't mean like speak in Spanish with an English speaker.
Right.
I'm talking about speaking English in a way at the level that the other person understands. And so I believe that one of the most powerful ways of conveying information is by using simplified language. I think it's my job to understand all the difficult labels and terminologies, but what my patients should get is easy to wrap around concept. So I use some graphics that I have designed to convey the process of opioid addiction and the treatment process. I do need to develop that for the other addictions.
Mhm.
So there's the communication. Then trust is another big one. Because if I can't trust that my patient will take the prescription and use it in a way that's beneficial and not harmful for them. That is very, very big to me. And
Mhm.
I'm sure with the patient, it goes the vice versa, because if they feel all they're going to experience is judgment, and have their hands be like slapped, which happens everywhere, to feel belittled, not having that respect, that also doesn't help with trust. So these are some of the tools that principles, and the other big principle is once again trying to get the body back towards balance as much as possible.
Okay. And so the modalities that you use, like, is your core modalities. You mentioned or I've heard that you use something called MAT. Can you talk about the various modalities that inform your actual practice of recovery?
Yeah. So MAT stands for medication assisted treatment, and that normally encompasses all the different addiction treatment process, whether you're using it for alcohol recovery, benzodiazepine recovery, or opioid recovery. Now, when we're talking about medicines that are used to treat opioid use disorder in particular, that's called MOUD, which is medications used for opioid use disorder. And I think people sometimes feel very hesitant to put in more chemicals in their body when they're trying to get away from the illicit chemicals. And so this is where I love to use this picture that I have. And if it's okay, I would love to share that with
Yeah,
your audience. Is
absolutely.
that okay? All right. So, pathophysiology of addiction and recovery. It basically means the process and study and disease that goes into addiction and what comes out of recovery. So in this picture, we are seeing a lot of stick figures standing on solid lines and then going down as if they're in a hole and lots of ups and downs. So we start on the left of the picture where we have a person who is standing in the sunshine on solid ground. The ground is the metaphor for our body's homeostasis or baseline. And as we proceed through, we see that when the person is being exposed to chronic opioids in the form of injections or pills, it starts to shift the body's baseline and the balance. And the body does that to protect the person because the body wants us to live. Because if we die, the body dies, right? So there's a constant dynamics of trying to return things to normal. So when these external chemicals are being introduced, the body starts to do one of three things. The first thing it does is it starts to pull away receptors where these exogenous or external chemicals come and bind to for the opioids, like fentanyl, heroin, prescription wise, like Norco, Percocet, etc. And that's how tolerance develops, where you will need more of the same drug to get the same effect as you did before. So this tolerance develops. And then when you go into the second thing that the body does, so our bodies make some natural opioids to begin with, and those are known as endorphins, enkephalins, etc. And when you have these influx of outside chemicals, your body starts to make less of your natural chemicals as well. So that's the second way your body's trying to protect yourself because if you have too much of it, what happens? You overdose and you die, right? When you overdose, you don't breathe. And if you don't breathe, you don't live. So the body is trying to do everything it can to do that. And then in some individuals, especially those who have the genetic code for certain enzymes, the body can increase the clearance of the opioids out of the system. So that's three ways the body tries to clear things out and go back to balance. And the longer it has to do that, the more you start to see that this straight line starts to curve down into a pit or a hole. And so what happens is that people who are at the bottom of this pit, that's basically the disease state in the body, that chemical gap is now created, and the body does not have the ability to close that gap on its own because of the way it changed. So then people end up having to use again. And at the beginning, when people are using, they're using to feel good, go up to cloud nine for recreational purposes. So it's a spike shooting up. They feel good, super good. And then there's a crash afterwards when the body is going. Now, when you use more opioids, then you need to return to baseline. That gap, chemical gap, gets bigger because your body keeps going on hyper mode to regain the balance and whatnot. So people get caught in this vicious cycle. So
Hmm.
that's the process of addiction. Now, when you're ready to recover and take back control, people come seeking help with doctors and other practitioners. And what we start to do is we want to start converting the amount of opioids that are needed to close the chemical gap. And we start to put in the medicines to close this chemical gap artificially. So people are not putting an unknown amount of substances and contents into their body. Because when they go to the streets to get these drugs, they don't get just heroin. They get fentanyl, they get ecstasy, they get all bunch of things. And they're like, I don't even do that. And so that's what leads to overdosing because if you're naive to a high concentration of opioid, it kills you very fast.
Mhm.
And so once that happens, we get to that stable dose, and then we want to maintain it. That's the second phase of the treatment. And that's where all the magic happens. When your body shifts from a survival mode to a stable mode, it starts to heal. And so I tell my patients that you want to be in this phase for about a year to let your body do its job with feeling good and, be done with damage control and then flourish. Meanwhile, you need to be addressing the other dimensions of you. So, like if you have PTSD, if you have undiagnosed depression, a social situation like divorce or death or whatever that pushes you into the addiction in the first place, you need to develop those resiliency and take care of yourself because the last phase is the taper phase. That's where we start to bring the medicine down a little bit at a time. And our body is really good with adapting over time, but very bad at rapid changes. So
Mhm.
this turns into a training, like bodybuilding. You don't just go from couch to the gym and start pushing 500 pounds all at once. If you do that, you will get injured, right?
Mhm.
So we want to honor the body's natural ability to heal. And so we slowly climb back up towards the normal homeostasis level, if possible, because for some people, the damage can be so severe that they can't go back to where they were. And so our goal is to get to the lowest dose of medicine that's necessary. And if that's zero, that's wonderful. If not, then that's where we recommend that the patients continue on certain amount of dose to, give their body the stability to function properly. So that is the pathophysiology of addiction and recovery. When we do the treatment, the first phase is finding the amount you need to close this chemical gap. That is called the induction phase. And then the second phase is the maintenance phase. This is where the body is healing and recovering. And the last phase is the taper phase, where you train your body to slowly go back towards normal level. So, this is what I do for visual storytelling to my patients.
That's wonderful. That's a very clear framework. Thanks for explaining that. Before we leave this slide, I just curious, and I'm sure this is a broader question, but just generally speaking, does this model apply to most drugs that have become addicted to, or is it specifically for opioids only?
So, the concept of moving away from balance as the disease progresses, I believe that is the common thing because your body changes in response to these radical hijacking of your reward pathway and all the other chemical things that happen in the process. Now, when it comes to alcohol addiction and like benzodiazepine addiction, I think it would be a little bit different because it's not just like one hormone that's being impacted. For example, in opioids, it's mainly the endorphin and the enkephalins, right? However, when you're going into like alcohol and benzodiazepine, you have a little bit more complex situation, which is GABA, which is like a inhibitory neurotransmitter or chemical hormone in your body that helps you with like relaxing things. And then the other hormone that gets impacted is glutamate, which is like the go, go, go hormone, so
Right.
excitatory hormone. So I think for that, I would need a little different picture. I need to think about it a little bit more to develop it. Methamphetamine and cocaine, those are stimulants. They don't have as many withdrawal symptoms. So I think I would need a little bit of a different picture to describe it. However, one of the ways that they cause damage is they facilitate worsening of other chronic conditions. So, like if you have high blood pressure or a heart disease, or if you don't, cocaine can cause heart attack, even if you have no other risk factors for it.
Mhm.
That's one of the things we used to see in the ER as well, where, a healthy young man or a woman would come into the ER with chest pain and the EKG is showing a heart attack. They have no cholesterol problem, no high blood pressure problem, no family history of it, but they're having a heart attack. And then you run the urine toxicology and there's cocaine in it.
Mhm.
So it's a different way of damaging the body as well.
Mm. So the storytelling aspect of it, this is one component, having your patients understand the process. What other aspects of storytelling or visualization do you like to use with your patients?
I like to use a lot of metaphors. I think at the end of the day, I'm a visual person. So, as I mentioned at the beginning, I like to use the example of sun in the horizon to kind of state, like, you need to find your purpose because when everything seems like it's hard and you feel like you can't get through the withdrawals, you just can't keep going on, life is getting so much harder, then I say, like, imagine, like, what are you here for? If you have this big purpose that like, the sun is going to come back eventually, and it's really hard to confuse it with anything else in the sky when it's up.
Yeah.
So lots of metaphor, figurative languages. And then sometimes when I have them in my coaching sessions, we will use guided imagery, visualization, breathing techniques, meditative techniques, etc.
Great. So, kind of from a wider view of things, how do you think the broader medical system could better support people that are in recovery right now? And what are some of the things that are missing?
I think we have made significant progress in the past decade towards being more receptive to patients with addiction as a disease. But I think it still needs to continue of raising awareness within the medical personnel that, just because somebody has the disease of addiction doesn't mean that they can't have anything else. So, for example, recently I had a couple who were in a motor vehicle accident. One of the partners, they broke their ribs and they needed to undergo surgery. And then when they were released from the hospital, they were not given adequate pain relief because they were on methadone and they thought that this would be good enough. But if you go back to the picture, the we're using the methadone only to bring them back to the surface level, and then anything beyond that. So if you have a baby, if you break a rib, you go through surgery, they need to be then treated with the same amount of pain medicine, titrated to their level
Mhm.
to address their pain management. So approaching pain in that way. And if you feel that, if you're a provider and you feel uncomfortable, you don't know how to do it, ask for help. Just like if I had to deliver a baby, like I would be finding who's my OB friend, and in the situation of emergency, like I wouldn't go and deliver a baby. I just don't have enough experience in it. So being able to ask help of each other. Next thing that needs to happen is a lot of the sober living facilities need to become more educated, informed about the different types of treatments, because I've found that oftentimes, a patient is trying to get into a safer, more stable housing situation to get away. They're doing great otherwise. And I have them on methadone, and then all of a sudden they'll be like, you can't be on anything if you want to come. So they're mistaking a treatment for a continuation of a harmful habit.
Right.
Even though we're like prescribing it, they're being compliant and monitoring and everything. So that's another place where I find that harm is done. Then the third thing is on legislative level, that we do need to recognize the impact of it. And recently a lot of fund, along with on many levels, right? So the addiction as treatment aspect, there was a lot of fund and support for trying to help support these individuals. And now that's gone. So I mean, on that note, we actually do have a lot of other things to worry about along with this. It's just part of a bigger problem.
Mhm.
So, yeah, across all of these levels. And I think understanding knowledge and the way that we speak with each other, trying to simplify things would probably help.
That's great. Yeah, I think the destigmatizing element is so important. I mean, we've seen such gains in other disease processes in mental health and also like in obesity by just destigmatizing it and actually looking at it from a disease model versus a character judgment. Because once you get past that block, progress can be made when really just serving the patients for what they're needing and helping them holistically from a disease model seems to be definitely the way of the future.
I agree. I agree.
So, what's your long term vision for Zanara?
My long term vision for Zenara is that hopefully this will become one of the most loved, most effective ways of taking care of patients because I think it will allow a lot of care to happen from the privacy of their home where they feel kind of hesitant for others to know them. And I hope that, individuals who seek out the care here have that same passion and way of thinking that, they're done and they are ready for the help and they're going to do it together with me. And, in the future I hope to hire, like-minded providers to support the journey. And I would love to eventually see it grow across the US.
Very nice. Very nice.
Yeah.
Well, I know we're almost out of time here, and I really appreciate you being on with us and sharing your vision. And it definitely seems like a great home for people, to land. I mean, that's kind of the feeling I get is like a home where people will understand you and understand your comprehensive needs. There's so many places where I think it's just sort of specifically directed towards one outcome, but to have a place that kind of meets you as a person is really helpful. And congratulations, it's really great. So, if you could just share in closing a couple things, like where can people reach out to you and follow your work, and then how do people refer to you? And also, just one thing that you'd like people to remember from this conversation.
Thank you so much, Dr. Indy. I appreciate that question. So, the best ways to reach me would be to check out the website and get on the waiting list if you're interested in becoming a patient. And if you're in California at this time, please go to zenaracare.com, zenaracare.com. And you can also shoot us an email at zenaracare@gmail.com, and we'll be happy to figure out how we can collaborate together for your success story. And in regards to a call to action, goodness, it's always such a powerful thing. I love to say that once you decide that you're going to become great and you have committed to it and you take a step in that way, you become greatness in progress. Okay? So instead of sitting around and being like, "Oh, one day I'll be good enough, one day I'll be this or that," and letting things hold you back, I invite you to encourage your new identity that you're already a greatness in progress and your destination is only a matter of time.
Wonderful. Such great encouragement and wisdom. And yeah, once again, thanks for being here.
My pleasure, Dr. Indy. Thank you so much for spending these few minutes with me today.
You're welcome. Thanks for tuning in to this week's episode. I really appreciate how Dr. Nasir reframed addiction, not just as a chemical dependency, but as a signal that something in the person's whole life, their mind, body, or spirit, is out of sync. Her metaphor of the chemical gap and the visual timeline of addiction and recovery was incredibly helpful. What stood out most to me, the phrase greatness in progress. That once someone commits to healing, even if it's messy and imperfect, they've already become something new. You can learn more about her work or refer a patient by going to Zara Care, And if you'd like to support the mission of destigmatizing addiction, remember, if this episode reaches 300 views in the first 30 days, we'll make a donation in Dr. Nasir's honor to Humane World for Animals. I want to give a big thanks to Dr. Nasir for this vulnerable, visionary conversation. And as always, if you found this valuable in today's episode, please share with someone who could use the insight. I also encourage you to drop some comments into the Instagram page for the One Thing podcast and let us know your comments and how this conversation moved you and influenced you. So until next time, please stay well and stay curious about learning and gaining more knowledge to improve your health and the health of others. Take care.